Go. We're back. We are back. Yes, we are. And remember what we're doing. We're doing chronic GI. And the next topic is a very exciting one for 2022, right? I have a very close friend. Matter of fact, when I'm done, I got to call that brother. I have a very close friend that just got done with bariatric surgery. Had a little bit of this and that going on, but he's going to be doing pretty good. And I have family members that have had weight loss surgery. And so this is near and dear to my heart. Now, we know that if you look in your chronic GI packet, you're going to see a handout that says dumping syndrome. And so what you're doing now is you're using that dumping syndrome handout, page 2, and you're using it to talk a tiny bit about weight loss surgery, because there is no dumping syndrome unless we have weight loss surgery. So it doesn't make sense to talk about dumping syndrome if we don't know what caused it, okay? So here we go. There is something called, and this is important, so I'm going to spell it out just in case you can't see it, R-O-U-X, ROU. This is a hyphen, and then it's E-N, N, and then another little hyphen, and Y. So Roux-en-Y is another name for gastric bypass surgery. That is very different from the sleeve. Now, you may have heard a million different surgeries: lap band, gastric sleeve, gastric bypass, Roux-en-Y. I'm only talking about 2 surgeries because we don't really do the lap band as much anymore. We found that was not the greatest. And so we have 2 that pretty much are the majority of weight loss surgeries. The Roux-en-Y and the sleeve have a lot in common. Let's talk about what they have in common, shall we? They both can be done through a laparoscopic surgery. They are both going to have you in the hospital for a day, maybe 2. They are both going to allow you to resume normal activities 2 to 3 days later, and they are both going to allow you to return to work within about 2 weeks, unless you have some kind of complication or something crazy. And they both are going to require strict follow-up for a lifetime, and they both are going to require that you take nutrients, minerals, and vitamins for the rest of your life. That's both of them. So now, how do they differ? Well, they both cut into the stomach, and this gastric bypass surgery, you stay right there now, I'll be right back. This gastric bypass surgery is going to create a pouch for your stomach, no bigger than that. In fact, probably more like a shot glass. That's how big your tummy is. Whereas the gastric sleeve is going to create a smaller stomach, but it's going to be more elongated. And the difference between these 2 surgeries is the part of the stomach that the gastric sleeve surgery cut away, it's going to be removed. It's gone. The gastric bypass surgery, when they cut your stomach and make a little pocket, a little pouch, if you will, a little hourglass, not hourglass, but a shot glass, little tiny itty bitty pouch type of thing, they don't get rid of the other part of the stomach. No, they don't do that. They allow that stomach to do its part in other ways with the intestines. But this type of surgery, the gastric bypass, because it didn't just remove that part of the stomach, it actually can be reversed. Now, you don't hear about that much, but I'm just telling you the differences. It could be reversed. Now, when we look at the differences in other ways, we know that the gastric bypass surgery tends to be really effective in a lot of people, but especially in women. Sometimes a gastric sleeve is not as effective in women. They can gain their weight back, and you can kind of have a little problem there. The other issue for the gastric sleeve is that those patients may, and again, this is may, everybody's different, they may have more GERD or reflux, severe reflux sometimes. Whereas gastric bypass, oh, no. It cures gastric reflux, okay? So those are the two different things. And to be honest with you, the only other difference, which is probably really important in terms of the surgeon choosing which one he wants to do for the patient. With gastric bypass surgery, you bet not smoke, period. Like you can never smoke ever. And you sure as hell should not be using NSAIDs. You know what those are, right? Advil, Aleve, Motrin, ibuprofen, naproxen, and all of those. No. Never. The patient with the gastric sleeve, it's not that they can smoke, so don't get it twisted, smoking sucks. No, it's that if they refuse to stop or they do something real ignorant and they go back, because you're supposed to stop for a whole month before the surgery. If they do something retarded, stuck on stupid, parked on dumb, ignorant, and they go back to smoking, it's not going to be catastrophic for them the way it would be if the patient had a gastric bypass surgery. Okay, so that's it. Now, these two surgeries, no matter which one you choose or which one you end up with, they both have what's called dumping syndrome. Dumping syndrome is where you have done some things that you probably never will do again, because dumping syndrome happens within 15 minutes or so of eating. For some people it can be delayed an hour or two, but for most people it's within 15 to 30 minutes of eating. And there are some rules that you have to follow after these surgeries, or even after a gastric, did I just say gastric? I hope you remember video 1. I told you when I say gastric, gas, anything, it was your stomach. So patients with weight loss surgery, or God forbid, but it happens, a gastrectomy, partial or otherwise, which is done when you have stomach cancer or an ulcer, and we take half of that stomach away, or the part that's diseased, we just take it away. If you've had any of those surgeries, you may have dumping syndrome. And dumping syndrome is so yucky that you don't want that. You don't want that ever again. So it's like the best deterrent to keep you flying straight. So what is it about dumping syndrome that is so bad? Well, let me tell you. 15 to 30 minutes after you eat, and we're going to talk about what you ate to cause all this hot mess, you're going to fall down almost. You feel like you could faint, fall out, drop, whatever, because you are sick to your stomach with abdominal pain. You have, remember what I taught you, N, V, and D. What's that, Shelly? Nausea, vomiting, diarrhea, any combination of that. So one of them you're going to have. You also feel faint. You start sweating profusely. You get hot and miserable. You actually feel like your blood pressure's low, if you can kind of identify what that feels like. That's like lightheaded and woozy. Okay, so you're doing all of these things. In addition to that, you might even feel your heart beating really, really fast because you have tachycardia and palpitations. And this is because you ate something crazy with these surgeries you just had. Okay, so what do we know about dumping syndrome? Why did you get dizzy? Why did you start sweating? Why did you feel shaky? Why did you feel like a mind out of body experience? Why did you feel that you could fall out? Why did you feel your heart racing and beating so fast? Believe it or not, it goes back to what you ate. Now, I know you probably forgot, but I did tell you in video number 1, basics of digestion, that fat takes the longest to digest and carbs digest the fastest. I also told Joe Behan in video 1 that at the end of your stomach, before you have surgery, was something called a pyloric sphincter. I told you at that time in video 1 that the pyloric sphincter delivered food slowly, methodically, and gently into the duodenum. The problem if you have a partial gastrectomy, the problem if you have gastric sleeve surgery, the problem if you have gastric bypass surgery is that we remove the sphincter. We take the pyloric sphincter away. And so when we take that pyloric sphincter away, and you sat up here and had you a milkshake, that food did not get delivered slowly, methodically, and gently. And instead, it dumped. Look at the picture. If you look at the picture, it's got an esophagus going straight down to the small intestine, like bloop. When you sent that food to the small intestine that fast, because you only had this little piece of a stomach, when you sent that food that fast to the small intestine, you shocked everybody, including the gangsters. Remember the gangsters, the mafia? Oh yeah, we're talking about Scarface up in here. Scarface, you don't remember who Scarface was? Oh, that's the pancreas. The pancreas like, whoa, hold up now. You don't just come in my house like this and start no shit. I got something for you. So it took its big, huge AR, what is it, 47, 57, 37, 20. I don't know what it is because I ain't got no damn guns. But it took its biggest weapon, insulin, sent it down there where you sent all that food, and made your blood sugar go down really fast. Now think, I need you to think, because you're smart, you are, you wouldn't even be here with me. When you have hypoglycemia, when your sugar goes really low, when you're hypoglycemic, you get shaky, you start sweating, you feel dizzy, you feel faint, you feel like a mind out of body experience. Yeah, you get the same symptoms that's on that paper for dumping syndrome, because that's exactly what's happened. You sent some sugary solution down to the small intestine, and it triggered the gangsters, and the gangster in this case was the pancreas. It sent out that insulin, and it devoured all that sugary nonsense that you had. That's why for dumping syndrome, you actually need a high protein, moderate fat. I know we were told fat was bad for you. No, it's not. We need a high protein, moderate fat diet, really low carbs, and you better get ready to write a select all on what else you need. You need to never drink when you eat. When you eat your food after these surgeries, you cannot drink with your food. Once you eat your food, you've got to wait 30 minutes or 45 minutes to drink whatever it was you call yourself going to drink. In addition to that, the food needed to be room temperature. Can't be too hot, can't be too cold, because the body don't understand. It's going to send you into some spasms. So you need room temperature foods. In addition to that, you can't eat too fast. Oh, no. You thought you was just going to gobble shit up? Nah, baby. Not only can you not eat too fast, you must keep the food that you eat something that could fit in a shot glass. I know that sounds retarded, don't it? Now let me help you with this. If you know anything about chicken wings, you know there's 3 parts. Now the wing part, don't nobody really care about that part. Don't nobody really eat that part. I got a crazy cousin to eat it all, but we're going to pray for him. But I'm talking about there's like 2 parts, right? There's 3 parts, and then there's the remaining 2 when you get rid of that little wing part. And it's like a little tiny itty bitty drumstick on one side, and then it's another piece of chicken that's attached to that, making a, you know what I'm talking about. Shit. Now, you couldn't even eat that whole wing. When you have this surgery, you better peel a piece off of that daggone wing, maybe the drumstick part, maybe the little other part, I don't know what you call it, but you got those 2 parts with meat on it. That and maybe a little broccoli tree, because those 2 together, a broccoli tree and a little bit of the wing, they fit in a shot glass together nicely. That's dinner. You can't go eating like you used to. You was Papa John's pizza, large, all of it at once with 20 wings. No. We're not doing that. We are eating tiny, small, itty bitty amounts that fit in a shot glass. And when we come out of surgery, we sure as hell ain't doing all that. We're doing clear liquids. Then if that goes well for a few days, we're gonna go to full liquids. And remember the difference. Clear liquids, I can see straight through. Nothing's in it. Examples: cranberry juice, apple juice, not apple cider, apple juice, grape juice. That's it. Full liquids, you cannot see through. Orange juice, you would put tomato juice in there. You would do Jello, pudding, that sort of thing. Jello actually is a clear liquid, so you're good with that. It's just a solid clear liquid, but you're good. Because it's all good, you can do that. Popsicles is a clear liquid. I know you can't see through it, but I'm saying if it melts, you can see through it. Okay, so you got to know that. And then after you do a couple days of clear liquids, you go to full liquids. And after that, we say, okay, now you can have a little bit of scrambled eggs, some really soft baked broiled chicken, a little cream of whatever soup, you know. Slow it down. Don't get crazy with it. This is what you have to know. Now, you've got to remember for this particular handout, what carbs are. Let's go over carbs, shall we? Let's do complex carbs first, because that's really what it's all about. You knowing what a complex carb is. Complex carbs include bread, pasta, rice, potatoes. And what do we say? If it's white, it ain't right. Those things have sugar in them. And bread is white, rice is white, pasta is white, and we said potatoes, right? So just teach your patient those have no business in their diet after these surgeries. They can't do it. Now, those were your complex, and you could add some more crazy stuff to it. You could say crackers, you could say a soft pretzel, you could say a bagel, you could put all that in there. That's all complex carbs. That's cool. Now, if we did simple sugars, you're really going straight to hell with dumping syndrome if you ate that. That's your pies, your cookies, your cakes, your pop, your juice. Yeah, you must like how that feel because you knew better anyway. And so if you ate any of those, we'll probably see a little butt in the ER. They ain't gonna do nothing for you because this is not who you see first. What do we do with this patient to keep them from doing and feeling and getting all crazy? Well, we teach what the diet should be, but then if they mess up, and sometimes you do, you tell them to lay on their left side so that you can slow down digestion. Oh, got to go back to glass. Gallbladder, liver, appendix, stomach, and sigmoid colon. And the spleen is in there, but it's not part of digestion. Now, why did I have to do that again for glass? Because if you think about the stomach is on the left side. So if you lay on the left side, you'll keep the food in the stomach longer. Remember, the problem is you sent the food down your esophagus through the stomach and whoom, right into the small intestine. No. If we lay on that side, left side Sims position, then you will gently send the food a little slower to the small intestine. And hopefully you won't wake up the gangsters and have them starting insulin fights and all this stuff. Now, I hope you got something out of that. Last thing. When you have these two surgeries, remember on your test you had to qualify for them. And I'm going to just show you what that means. You see here, it talks about BMI. Let's remind ourselves what BMI is. If you need a weight loss surgery, you can't have a BMI of 12, right? So let's not get stupid. Here we go. Normal BMI is 19 to 24. 25 to 29 is overweight. This was normal. Once you hit 30, that's called obesity. Oh, okay, obesity. Here's the big one. When you hit 40, that's called morbidly obese. And I want to tell you something about this because this is a big deal that you understand what we're talking about. To qualify for this surgery, you must have a BMI of 40. That alone will get you in the OR. Now, when I say morbidly obese, people get very confused between the two terms. Morbidly, mortality. Mortality means death. Morbidity means disease. So when I say you're morbidly obese, I'm talking about morbidity, which is disease, which means you have at least 5 diseases already. No matter what you do, if you have a BMI of 40, you already have 5 diseases. What are those diseases? Select all that apply. Here we go. Obesity-related conditions or diseases. Here we go. GERD, high blood sugar, or if it's not high blood sugar, it's at least insulin resistance, which means you're on your way. High blood pressure, and don't forget that's 130s over 80s and higher. And you also have arthritis. So your knees hurt, Your back hurt. All your little body parts hurt because you're stressing the hell out of them with all that weight. Your knees were not meant to carry that. Your back was not meant to carry that. And you are stressing the hell out of it over these years. Now, the last one is sleep apnea. You ask the kids, you know your behind snores so loud the next door neighbors is disgusted. You know it. And you probably need CPAP, a little oxygen to help you at night, little machine that goes over your face and pushes air through your lungs, because snoring like that and stopping in the middle and not breathing and all the shit that you're doing, that's gonna kill you. I'm being real with you, because that's gonna kill you or give you Alzheimer's or both, and I really don't want that for you. Now, so what happens with this patient? Well, that's why I started this situation off when I talked about all these surgeries, telling you about the people that I know that had them that did great. My family, one of my family members had gastric bypass surgery, and let me just tell you, she was 300 pounds and 5 foot tall. She got rid of all that weight. She's a size 5'6", still is 20 years later. And, are you ready for this? Got rid of all reflux disease, heartburn, GERD, whatever the hell you call it. She got rid of all knees and back pain. That was really liberating because she could do a lot more. She's very active. She got rid of her sleep apnea and that stupid loud ass CPAP machine. She also got rid of any hints of high blood pressure, and the big one, the one that's going to kill us all, she decreased her blood sugar, and she never needed insulin before, but she sure as hell don't need it now. So I'm just trying to tell you that there is a purpose and a place for this surgery. It's just the last resort. Now, if you don't have a BMI of 40, but you have a BMI of 35, and you've got these same problems with the 5 on the board, these are obesity-related diseases, then you also qualify for this surgery. If I were you, though, just a word of caution, I would try intermittent fasting and keto first. It's a lot easier than major surgery, which has as its problems some complications that you could have. But if you've tried it all and nothing's working, I am praying for you to go through one of these surgeries and know that it's really, really effective. Good luck. Peace out.